Zelapar is used with levodopa/carbidopa to treat movement disorders caused by Parkinson's disease. It doesn't cure Parkinson's disease, but it may improve shakiness, muscle stiffness, and sudden switching between normal movement and stiffness. It may also improve your range of motion and ability to walk, dress, and exercise. Selegiline, the active ingredient in Zelapar, works by slowing the breakdown of certain natural substances in the brain, such as dopamine, norepinephrine, and serotonin. When taking Zelapar, you should dissolve the tablet on your tongue as directed by your doctor, usually once a day in the morning. Avoid swallowing the tablet or the dissolved medication with saliva or water. It should be absorbed through the lining of the mouth. To prevent accidentally swallowing any of the medication, refrain from eating or drinking anything for at least 5 minutes before or after using this product. Before taking the tablet, make sure your hands are dry. Peel back the foil on the blister pack to carefully remove a tablet. Do not push the tablet through the foil. Immediately place the tablet on your tongue and allow it to dissolve completely. Do not crush, split, or break the tablet before taking it. Do not remove the tablet from the blister pack until just before taking. Taking Selegiline late in the day may cause trouble sleeping. The dosage is based on your medical condition and response to treatment. Your doctor may change your dose to find the best dose for you. Do not increase your dose or take it more often than directed. Your doctor may direct you to lower your levodopa dose if you are experiencing more side effects while using Selegiline. Follow your doctor's instructions closely. Do not stop or change the dose of any of your medications without first talking with your doctor. Use this medication regularly at the same time each day in order to get the most benefit from it. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. It may take a few weeks for the full benefits of the drug to be noticed. Talk with your doctor if the medication stops working well or if your condition worsens. Side effects of Zelapar may include dizziness, abdominal pain, dry mouth, nausea, stomach upset, trouble sleeping, headache, and redness, pain, and swelling of the mouth/throat. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If you are taking levodopa, you may experience more side effects from it when taking Selegiline. Tell your doctor right away if any of these side effects occur: nausea, shakiness, muscle stiffness, mental/mood changes such as hallucinations/abnormal dreams. Your doctor may need to change your medication or dose. Do not stop or change the dose of your levodopa without talking with your doctor first. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Some people taking Selegiline have fallen asleep suddenly during their usual daily activities. If you experience increased sleepiness or fall asleep during the day, do not drive or take part in other possibly dangerous activities until you have discussed this effect with your doctor. Tell your doctor right away if you have any serious side effects, including fainting, loss of balance, mental/mood changes, unusual strong urges, worsening muscle stiffness/twitching, changes in sexual ability/interest, increased shaking, tremor, swollen ankles/legs, difficulty urinating, unusual weight gain, easy bleeding/bruising, black/tarry stools, vomit that looks like coffee grounds. This drug may rarely cause an attack of extremely high blood pressure, hypertensive crisis, which may be fatal. Get medical help right away if any of these serious effects occur. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome. Get medical help right away if you develop symptoms such as hallucinations, unusual restlessness, loss of coordination, fast heartbeat, severe dizziness, unexplained fever, severe nausea/vomiting/diarrhea, twitching muscle. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects. If you notice other effects not listed here, contact your doctor or pharmacist. Before taking Zelapar, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, let them know about your medical history, including any adrenal gland tumor, cerebrovascular disease, heart problems, bleeding problems, diabetes, mental/mood disorders, high blood pressure, kidney disease, liver disease, or overactive thyroid. Zelapar may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. Avoid driving or using machinery until you know how this medication affects you, and limit alcoholic beverages. If you are using marijuana, talk to your doctor. Inform your doctor or dentist about all the products you use before having surgery, as you may need to stop taking Zelapar. If you have phenylketonuria, PKU, or any condition requiring you to restrict aspartame intake, consult your doctor or pharmacist before using this medication, as it may contain aspartame. Older adults may be more sensitive to the side effects of Zelapar. During pregnancy, Zelapar should only be used when clearly needed, so discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so breastfeeding is not recommended while using this medication and for 7 days after the last dose. Consult your doctor before breastfeeding. Zelapar may interact with a variety of medications, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some of the products that may interact with Zelapar include antidepressants, other MAO inhibitors, appetite suppressants, drugs for attention deficit disorder, certain herbal products, cold medications and nasal decongestants, street drugs, stimulants, supplements, certain triptans used to treat migraine headaches, and more. The risk of serotonin syndrome/toxicity may also increase if you are taking other drugs that increase serotonin, such as certain antidepressants, opioid medications, and street drugs. It's important to discuss any other medications you are taking with your doctor or pharmacist, as well as to check the labels on all your medicines for certain ingredients. Additionally, it's important to follow a special diet in order to limit your intake of tyramine while taking Zelapar. Foods and beverages that are high in tyramine include aged cheeses, dried/aged/fermented meats and sausages, preserved fish, products containing large amounts of yeast, fermented foods, most soybean products, certain beans, red wine, sherry, tap beers, and vermouth. Foods that are moderate in tyramine include avocados, bananas, eggplant, green beans, and more. Be sure to consult your doctor or dietitian for more details and a complete list of other tyramine-containing foods. Lastly, Zelapar may interfere with certain medical/lab tests, so it's important to inform lab personnel and all your doctors that you are taking this medication. If you or someone else has taken too much Zelapar and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help immediately. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may not show up for up to 12 hours and could include restlessness, weakness, drowsiness, flushing, sweating, fast heartbeat, confusion, and seizures. After a suspected overdose, you may need to follow a tyramine-restricted diet for several weeks. It's important not to share Zelapar with others, as it is prescribed specifically for you. While taking this medication, your doctor may want to monitor your blood pressure and other medical tests. Be sure to keep all of your medical and lab appointments and consult your doctor for more information on how to take Zelapar. If you forget to take a dose of Zelapar, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and take the next dose at your regular scheduled time. Do not take a double dose to make up for the missed one. When you get your Zelapar prescription, make sure to store the blister packets in the pouch provided. Keep them at room temperature, away from light and moisture, and out of reach of children and pets. Remember to discard any remaining tablets in the blister packets 3 months after opening the pouch, as the medication may no longer work after that time. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.